Welcome back to Science with Shri. Today we have Dr. Vivi Sambasiva Rao with us to discuss the topic of cataracts. So before we get started, let me explain a little bit about the basics of the eye. If you haven't already watched my eye video, the link is in the description. Okay, so this is the model I made of the eye using foam, styrofoam, and paper. So I want to give an overview of each of the main parts of the eye. Firstly, let's talk about the three layers of the eye. The sclera, which is the first layer, the choroid, which is the second layer, and the retina, which is the third innermost layer. Now let's talk about the cornea, which is right here. So the cornea is the clear front surface of the eye, and it is 10 to 12 millimeters in diameter, and the corneal thickness measures 0.5 millimeters. So the cornea has 5 layers. Number 1, the corneal epithelium. Number 2, the Bowman's layer. Number 3, the corneal stroma. Number 4, Descemet's membrane. And 5, the corneal endothelium. So the main function of the cornea is that the cornea works as a refractive media to focus the image onto the retina. The cornea is avascular, which means that the cornea has no blood vessels. The cornea gets its nutrition from the aqueous humor, which is secreted by the ciliary body. Now let's talk about the iris, which is here. So the iris is a circular diaphragm with a central hole called a pupil, which is on this model right here. The iris has a circular and radial muscle to change the size of the pupil as per intensity of the light. So the iris works like an aperture in a camera. Now let's talk about the lens, which is right here. So the lens in the eye is located behind the iris and in front of the vitreous body. It is of an ellipsoid shape, and its size is 10.4 millimeters approximately. It is transparent, flexible, and can change its shape. The function of the lens is that it focuses the image onto the retina. The lens is also avascular. I've been mentioning the retina a lot in this video. So, what's the retina? The retina is the inner sensory membrane of the back of the eyeball. It has 10 layers and it contains photoreceptor cells, for example, rods and cones. The cones are responsible for day vision and color vision, and the rods are responsible for night vision. A part of the retina is the macula. The macula contains the maximum number of cones. It has a fovea, a small depression in the center. The fovea is responsible for maximum acuity. Now let's talk about the vitreous body, in which there is the vitreous humor. So the vitreous humor is a gel-like substance that fills the posterior part of the eye and helps the eye to keep its shape. So I've talked about all these parts, and except the conjunctiva. So what is the conjunctiva? The conjunctiva is a layer covering the sclera. So now that we've reviewed the basics of the eye, let's dive into cataracts. So what even are cataracts?
So, cataract is a condition wherein the lens of the eye, which is usually clear, becomes cloudy or opaque. Actually, the lens is biconvex and is situated behind the pupil in the eye, and it focuses objects on the retina.
Okay, so what are the different types of cataracts?
Coming to the various types of cataracts, they can be classified as follows. First one is congenital cataract. That is, the baby gets cataract by birth for various reasons, like it may be genetic or some metabolic disorders or infection of the mother during pregnancy. Then comes senile cataract. That is the most common cataract. The senile cataract may be cortical cataract, second nuclear cataract, third subcapsular cataract. Again, subclassification of these senile cataracts depends upon the position, anatomical position of the opacity. They can be classified as anterior cortical, posterior cortical cataracts if they are in front part of the lens or posterior part of the lens. Same way, anterior polar cataract, posterior polar cataract if they are on the poles of the lens, or anterior subcapsular cataract, posterior subcapsular cataract, that is just beneath the capsule, either anteriorly or posteriorly. The third one is metabolic cataracts. These metabolic cataracts may be due to diabetes. As usual, many patients having diabetes, they are prone to develop cataracts at an early stage. Then the other type of cataract is complicated cataract or secondary cataract. It means secondary to some other disease in the eye. For example, like iridocyclitis, glaucoma. Again, traumatic cataract is another type, as is noted in the name itself, due to trauma, that is injury. Either it may be blunt injury or penetrating or piercing injury. Again, one more cataract is drug-induced cataract. Patients, some of the people, they use steroids for longer periods, for months, sometimes some years, for some other medical problems like rheumatism or some other problems, nephrotic syndrome, whatever it is. When they use steroids for long periods, that is, they develop cataract due to this drug steroid. This is called drug-induced cataract. Now, the other type is radiation cataract. When the person is exposed to some radiation, they develop cataract. These nuclear cataracts also can be graded as 1 plus anterior, 1, 2 plus uniform haziness throughout the nucleus, 3 plus, 4 plus, like that. That is subclassification of nuclear cataracts. Okay.
Okay. So now let's talk about the surgical procedure for cataracts. What is the typical procedure for cataracts?
The most common type of cataract surgery is phacoemulsification. During this procedure, the rapidly vibrating tip of an ultrasound probe breaks up the cataract into 4 segments. These lens fragments are sucked out through the probe, leaving the posterior capsule of the lens intact. The selected IOL is introduced into the capsular bag and dialed to the position. IOL is selected by A scan. It is done before surgery to determine the power of IOL that suits the patient. In this procedure, there is no need of suturing and the eye is closed after giving antibiotic injection subconjunctivally. Then comes the latest cataract surgery procedure, that is FLACS, FLACS, that is femtosecond laser assisted cataract surgery. It is the latest technique. Herein, laser is used for giving incisions, cataract fragmentation, thus improving accuracy and also corrects astigmatism. The remaining part of the procedure is same as above.
How can we prevent cataracts? How can we prevent our eyes from getting cataracts now?
Protecting your eyes from UV radiation, maintaining a balanced diet rich in antioxidants, avoiding smoking and alcohol, and managing chronic diseases like diabetes, of course with regular checkups, eye checkups.
Thank you for your time today, doctor, and thank you, viewers. Make sure to like and subscribe. Thank you.